everyone, it's Nurse Sarah, and in this video I'm going to demonstrate how to draw blood. So let's get started. When drawing blood on a patient, the very first thing you want to do is you want to verify the provider's order. So take a good look at that order and check out what has been ordered. Then you want to ask yourself, are there any specific requirements that need to be done before you actually draw the blood? For example, maybe the patient needs to be NPO, nothing by mouth, before you actually draw the blood. This is the case with metabolic panels, iron studies, just to name a few. And then you need to make sure that this lab is not time specific. Like you have to draw it at a specific time. For example, like with hormone levels, cortisol, it's best to draw that in the morning. Or if you're drawing a trough level, you want to check out when it actually needs to be drawn. For example, if it's vancomycin, most protocols say that that needs to be drawn about 30 minutes before the 4th dose. Then you want to make sure that you have the right patient per your facility's protocol. And this is usually through using at least 2 patient identifiers. So the patient's full name and their date of birth. And you're going to have the patient state that information back to you. Then you're going to compare that information to their armband. Next, you want to take some time to ask the patient some important questions and then educate them about the procedure and answer any questions that they may have. So some important questions to ask would include allergies. Are they allergic to latex, alcohol, adhesives? Are they taking any anticoagulants? Do they have a history of a mastectomy, AV fistula, or grafts? And how do they tolerate blood draws? Along with, do they have any preferred site that you should use to actually draw their blood? Because many times patients know which veins are the best. Then you want to take a look at the patient. Do they have any IV infusions going? You want to avoid using these limbs. Also, look at the skin. You want to avoid areas that are edematous, they have infection, or vascular compromise. After doing this, you'll want to gather your supplies. So what you need to collect before you actually start the procedure includes a tourniquet, alcohol prep pads, gloves, gauze, tapes, or Coban. I'm also going to have a towel to help position the patient's arm and a bin to help hold the supplies, a biohazard bag, sharps container, and then the specific device you'll be using to draw blood. Here I'm going to use a blood collection set known as the wing butterfly needle set. And whatever you use, you want to be familiar with your equipment. So let me quickly go over what I have here. Here I'm going to be using the winged butterfly, which you can tell by its appearance with its little wings. And I'm going to get any accessory that I need to use with this. So on your packaging, you always want to get familiar with your equipment because you can use different stuff to draw blood. On the packaging, it tells me what I'm using, what it's used for, the size, and the expiration date. And here, I'm going to be using a Vacutane tube holder that will actually screw and go onto this, and you can see that here in a moment. So I'm going to open this up. I'm not going to actually use this for the actual blood draw, but I just want to open it up so I can show you the parts of it. To open it up, you're going to find an arrow on your packaging. You're going to peel that back. Just hold that and then just peel it open. So let's look at these parts up close. Okay, here, right here, you have this little sheath part. This is protecting your needle. You take this off whenever you're actually ready to use it. And here you have textured sides of your wings. These are the sides you're actually going to hold whenever you're going to stick the patient. And then on the top, you will have a little number that has what gauge you're using. Here it says 21. Now, connected to this is some tubing. This is where the blood is actually going to draw down through, and it's going to go down through here. And this part is a gray little rubber stopper, but inside of it, it has a needle. See, right here. And this is what pierces your tube and allows the blood to flow down in it. Now, this tube holder actually screws onto here like this. And you will pop your tubes through here. Now, another part, one of the most important parts of it to prevent injury, I'm going to take this little sheath off so you can see how it works, is the little safety activation. Some of these have buttons that you would hit and it would retract the needle. This is a little bit different. When you're done using it, you're actually just going to slide it off like this, and then you can discard it into the sharps when you're done with it. You also want to get the tubes that have been ordered on your patient. So let me quickly go over the anatomy of a lab tube. So your lab tubes are going to have different colored tops, and on the tube, if you take a peek at it, You're going to see, here I'm using vacuette tubes, you're going to see what kind of additive that this tube may have. Not all tubes have that, like this one is sodium citrate. And like this one is a white, it says no additive. Now, a lot of times white is going to be used as a waste tube. So on your tubes, along with that, you're also going to have a fill zone or fill mark. This right here is the sodium citrate. It has a specific blood to additive ratio, so it's really specific in how much you need to fill it. It will have this arrow to help guide you. Like the bottom of the arrow will be the minimum mark, the middle is the mid mark, and then the top is the maximum mark. The other ones will have like a little square, black square, and this is your fill zone for that. In addition, you're going to have an area where you could fill out the patient information if you needed to. A lot of times today we have stickers that we put here, but maybe you work somewhere where you have to actually fill this part out. Now, one important thing you must remember about your lab tubes is the order of draw, because sometimes a patient may just have one lab ordered, so you just have to do one tube. But sometimes they may get the whole rainbow, and you've got to know how to put those tubes on in a specific order, because we don't want to risk contaminating tubes with certain additives. So you're going to follow an order of draw. Here I have the order of draw on a mouse pad. I also have it on a poster. If you want to get it for reference, you can get it at nursera.com. So let me quickly go through that with you. So first up will be the yellow tube, also known as our blood cultures. It can come in the yellow tube, but you could also do it in bottles. And it has additive SPS in it. Now with it, you will do an inversion of 8 to 10 times with that. Now whenever you invert, you will hold the tube like this, your color part's up here, and you will invert it the amount it's supposed to be inverted. After that will be your light blue tube. It has the additive sodium citrate. This is what's going to be in your coagulation studies. The inversion time is about 3 to 4. Now one thing I want to point out about this is this part right here. If you are drawing this first with that butterfly that we talked about earlier, you have to have a waste tube before you pop on that tube. So let's say that's part of your first draw, that's the first thing you're going to draw, or that's the only thing you're going to draw. You have to have a waste tube, and that was that tube that I went over earlier. It has no additive in it. Because if you take a peek at our tubing, that's a lot of air in that tubing. And remember I said that this tube is a special tube. It has to have a specific blood to additive ratio. So we have to clear this air from this tube into our waste tube, and then we can pop that tube on. Now with that said, one thing I do want to say is that I know all facilities are different with their protocols with how to waste whenever you are using this butterfly tube, because some facilities may say when you're using the butterfly needle set, you have to use a waste regardless. So just keep that in mind and always follow your facility's protocols. Next is the red tube. In the glass tube, it doesn't have an additive. In the plastic, it has the clot activator. Here, you're going to have serology, immunology, certain drug levels. Version time, none for glass, 5 to 10 for plastic. Followed by that will be your gold or your tiger, your SST tubes, your serum separator tubes. It has the clot activator and gel in it. This is a lot of your panels like metabolic, liver, lipid, and hormone levels, in versions 5 to 10. Followed by your greens. Here we have light green, and it has lithium, heparin, and gel in it. These are like your stat chemistries and cardiac monitors. It has an inversion time of 8 to 10. Then the dark green or the green color has a sodium heparin. It's going to be your stat chemistries, your ammonia, again put that on ice, and some drug levels. Has an inversion time of 8 to 10. Purple, also known as lavender, has EDTA in it. That's going to be your CBCs, your hemoglobin A1Cs, and so forth. Inversion time is about 8 to 10 times. Followed by the pink, which has the same additive as the lavender, the EDTA. This is your blood typing, like your cross-matching type and screening. Inversion time 8 to 10. And then gray, this has sodium fluoride and or potassium oxalate in it. This is going to be like your lactic acid, again put that on ice, and blood alcohol levels, glucose, and its inversion time is about 8 to 10. Now, how can you remember the order of draw? Well, here's a mnemonic I created to hopefully help you. It says, your labs require good labeling, great phlebotomists prevent gaffes. So the first letter of the mnemonic will correlate with the colors. And then after you've collected all of your supplies, you want to perform hand hygiene and don PPE. To set up your supplies, you want to do it in a way that makes sense to you, because one hand is going to be very busy holding the needle so it doesn't move out of the arm, and then the other hand is going to be grabbing the supplies. So to set up your collection set, whatever you're using, I'm going to do like I did earlier. I'm going to peel this open, and I'm going to make sure everything is ready for me. So I'm just going to take this out right here, and I'm going to leave this part in there, but I'm going to go ahead and screw on to this. I'm going to leave that there. And then I have my gauze, which I'll need to place over the site once I have removed the needle. And then the other super important part are your tubes. So get the tubes that you need and go ahead and put them in the order of draw based on whatever's ordered. So I'm going to be doing a waste tube in the white top. Then followed by that, I'm going to do my sodium citrate, the light blue. Then I'm going to do my green, the lithium heparin, and then the lavender, also called purple, with the EDTA. And I'm going to have Coban ready, or tape, whatever the patient prefers. So what I'm going to do is I'm going to use the antecubital area, the AC, the bend of the elbow, and I'm going to apply a tourniquet. You don't always have to apply a tourniquet. In some situations you wouldn't want to, depending on what type of lab result you're drawing, or if you have an elderly patient who has fragile veins. So what I'm going to do is I'm going to put the tourniquet on about 3 to 4 inches above the insertion site. I'm going to take this, put some tension on those ends, and then I'm going to make an X like I'm crossing a shoelace. Then I'm going to take one of these ends of the flaps and just put it halfway so I can have a quick release. Now I don't want to leave this tourniquet on more than a minute because it could alter the lab results, cause hemoconcentration, and if I forgot and left it on more than a minute, I could take it off, wait 2 minutes, and then reapply. So I'm looking for the veins. A lot of times when you pop that tourniquet on, these veins are going to pop out at you, and I'm going to feel around. Veins have a unique feel. They're very bouncy and squishy, and you can feel them. They're not going to have a pulse. They're not going to be cord-like or hard. That, you know, if they have a pulse, that's an artery. So I like this vein right here, so I'm just going to pop this tourniquet off, and I'm going to clean this site. And you want to clean per your facility's protocols. I'm going to use a back and forth friction motion, and I'm going to clean this site for about 30 seconds. And once I have done that, I'm going to let it completely dry on its own. I don't want to take a clean gauze and try to accelerate the drying speed or blow on it or wave on it. Now we're ready for the venipuncture. So I've reapplied the tourniquet, and you don't want to touch the site since we have it clean. And can you make a fist for me? I have my butterfly collection set. I'm holding it by the textured wings. I'm going to remove the sheath. And you want to make sure your tubing's uncoiled and you have your holder. You can keep it in your hand like this, or you can lay it next to the patient on a clean surface. It's whatever you prefer. So I'm going to anchor the vein just a little bit by going 1 to 2 inches below the insertion site and pulling the skin taut. Then I'm going to insert at about a 15 to 30 degree angle. I'm looking for blood return, which I have, and I'm just going to seat my needle a little bit. So I've lowered my angle and insert about 1 to 2 more millimeters, about a thickness of a nickel. Now I'm just going to stabilize it. First, I'm going to pop on my waste tube. So have this. Now I've established blood flow. So I'm going to quickly release your fist and pop this tourniquet off. I'm going to let this fill about 3 to 5 milliliters. That's good. That's my waste. I'm going to just set that aside. Now I'm going to do the blue. Let that fill all the way to the fill line, because remember that was an important tube. And it's filled exactly where it needs to go. Now I'm going to invert it about 3 to 4 times. 1, 2, 3, 4. Set that in my basket. Now I'm going to do my green. And making sure letting these tubes fill from top to bottom. Again, looking at my fill line. Okay, that is full. Now I'm going to invert that about 8 to 10 times. So 1, 2, 3, 4, 5, 6, 7, 8. Set that aside. Then I'm going to pop on my last tube. Again, letting it fill to the fill line.
Okay, that's done. Now I'm going to invert that 8 to 10 times. So 1, 2, 3, 4, 5, 6, 7, 8. Set that aside. Now I'm ready to remove the needle. So I'm going to take some gauze and I'm going to quickly remove the needle and then put the gauze on because I don't want to get a needle stick. So I'm removing a needle, holding pressure, and then I'm going to engage the safety on my needle by sliding that forward. Now I'm going to hold pressure, and this tubing, the needle, and the holder all go in the sharps container. So we'll put that in the sharps, and we're going to hold pressure. You might have to do this for a while if your patient's on anticoagulants. And if your patient is able, you can ask them to do this for you, but it's whatever you prefer. So now I'm going to look at the site and just make sure it's quit bleeding, and it has, but I still want to protect the site. So you can take tape, you can take Coban, whatever the patient prefers. So I'm going to use some Coban to secure it. I'm going to apply pressure right here. And then I'm just going to go around just one more time, and I'm not putting it too tight, just tight enough to apply pressure. Okay, and that's good, and I'm going to tear it off. You can tear it or cut it, it's whatever you prefer. And then I'm just going to give it a little squeeze, make sure it sticks to itself very nicely.
Once you're done with that, you want to make sure that you take those lab tubes and you label them at the bedside in the patient's presence. Then take those lab tubes, put them in a biohazard bag, doff your gloves, perform hand hygiene, then send the specimens to the lab, and then document the procedure as required. Okay, so that wraps up this quick demonstration on how to draw blood. And if you'd like to watch more nursing skill videos, you can access the link in the description below.